which is a collaboration of about 30 or more organizations from around the country that's focused on HIV in Black communities. And we'll talk a little bit about some of the policy work that we've done over the past year together.
Thank you so very much, Gary. Again, Max Boykin, Black AIDS Institute. I'm the Policy and Organizing Manager at BAI. I also manage our Black Treatment and Advocates Network. I see some of our BTAN members in the crowd. Love having y'all here. Along with that, the Black AIDS Institute is one of the only national think and do tanks working to end the HIV epidemic from an unapologetically Black and uniquely Black perspective. With that, we are headquartered in Los Angeles, but I live in Atlanta, Georgia, along with where a lot of our BTANs are, which are in the southern United States. And I'll be talking about some of our initiatives with Black South Rising, HIV Racial Justice Now, and then also the policy priorities of the Black AIDS Institute. Uh, yeah, let's see. I gave another minute. I know that we only have an hour here today. I can go ahead and get us started. With that, I will kick it off for Gary to talk a little bit more about United We Rise. I'm also a member of United We Rise, which was started last year. And the planning of it actually started in 2019, but I kicked off some of the pieces last year, and I will let Gary explain more of what United We Rise is and also the policy lens that we helped create last year.
Great. Well, thanks for joining us, everybody. Again, my name is Gary Daffin, and I'm the Executive Director at MAC, Multicultural AIDS Coalition. But United We Rise is an initiative that was started back in 2019. We were originally going to have an event in May of 2020, but as you know, everything changed and we ended up pushing that back. But we came together to have a conversation among Black people with people from different places, different parts of the country, different walks of life, to talk about what is it that we need to end the epidemic among Black folks, given that we have kind of hit a plateau over the past many, many years with our being the largest group of people affected by HIV and not really making a dent in that last hardest segment of folks to reach. And so United We Rise was convened by the National Black Gay Men's Advocacy Coalition, the National Black Women's HIV/AIDS Network, and MAC. We brought together over 30 different organizations that met for 3 long, interesting planning sessions over the course of October through February of 2019. And one of the things that we wanted to talk about and wanted to look at were what were some of the intersectional issues that needed to be addressed in order to deal with policies affecting Black folks. So we had a convening, we pushed our convening from May till December, and it just happened this past December for 3 days. And we invited about 200 different people who came into the group and worked in breakout sessions to look at a number of different issues. And this is just a quick look at the agenda. One of the main issues we looked at was intersectional policy as a liberatory practice. And then we looked at what are some of the things that are needed in terms of intersectional policy at the state and federal level. And before we did that, before the convening started, we wanted to take a look at some of the existing policy initiatives that were out there. This is just a snapshot of some of the people that were at our convening, and Dominic Jackson was our MC. And that is all posted on the website, Every Black Body, that you can take a look at and see more information about United We Rise and some of the videos that we did over the course of the year. But looking at the policy initiatives, this is just a summary of, we looked at 5 different policy documents, 7 altogether actually, some focused on HIV in particular and some focused on broader issues. And we're going to hear from some of those today, so I won't go through them in detail. I'll do just a quick summary, but just to take a look at some of who the people were who were involved in this. Black AIDS Institute, who we're all familiar with. We're going to hear more about them. The Southern Black Policy and Advocacy Network, we took a look at the assessment that they did, focused on Black communities in the South. The Black Women's Health Imperative has an agenda focused on Black women that we included in our review. Black South Rising, I think we'll hear a little bit more from them today. An agenda again focused on the South. There was a report done by the Office of Minority Health in conjunction with researchers and community activists focus on African immigrants and HIV/AIDS needs and for those communities. And also Baji, the State of Black Immigrants report that they did, we also looked at that. And finally, we looked at the Vision for Black Lives that the Movement for Black Lives put together. You can't really see this on here, but just to bring it up a little bit, these were broader issues like ending war and reparations and investing in Black communities and economic justice beyond just HIV, but that we thought were important to include in our analysis. So just to do a quick summary of what the document that the summary, the sort of synergy report, we called it, looking at what some of the similarities, what are some of the common themes that we found in those reports, obviously not getting all the details, but so I think the main thing that we saw in those reports was the understanding that despite major biomedical advances in treatment and prevention, that Black communities are often not accessing these advances and not benefiting from all of the same, from all of the great technologies that we have to prevent and treat HIV. And that lack of access to health insurance is a major factor in depriving people living with HIV from treatment and services. The reports identified some key populations. Important among them are, one second, gay, bisexual, transgender, and queer men, same gender loving men, Black women who are often not included in research and in the overall picture of what's happening with HIV in Black America. Black immigrants, another group that is in many ways not focused upon because we don't really capture information on various Black immigrant communities who are impacted by the current situation, the current environment, anti-immigrant environment, just as other immigrants are, and of course, Black transgender women. So those were some of the overall things. Just to take a look at some of the specific policy areas for policy mobilization that we teased out of it, out of those reports that were, again, some of the commonalities, some of the things that people thought we needed to focus on. So I'll just go through those. First, divest and dismantle destructive systems and institutions that harm Black lives. Again, this is beyond HIV. Invest in solutions that address root causes of increased vulnerability to HIV. And I think we all know that those root causes increased vulnerability to all kinds of diseases and bad health outcomes, negative health outcomes. Expand access to universal health care that is culturally and linguistically appropriate. Demand sexual health education and facilitate access to prevention technologies such as condoms, PrEP, and syringe services. Increase community energy and urgency about ending HIV. I think there's a sense that we have, like many people in the country, believe that HIV is no longer an issue, but we know that for us it's a primary issue still. And then reform public policy that stigmatizes and criminalizes people living with HIV and inhibits effective prevention for people at increased risk of HIV acquisition. I think we'll hear more about that later on. Hold elected officials accountable for implementation of transformative policy to eliminate HIV inequity in Black communities. Promote Medicaid expansion, which we've mentioned before, and integrate specific strategies that address inequities for Black populations most impacted by HIV/AIDS, including gay and bisexual and gender nonconforming men, women at increased risk, both cisgender and transgender, people who inject drugs, immigrants, and others. And then, so finally, just looking at what were some of the broad things that people thought we should focus on in order to move forward. And there was an optimism that if we could have sustained energy for Black communities, from Black communities around HIV, invest in Black visions that to end HIV and other health inequities, fully resourcing Black-led organizations, and to have strong collaborations between Black organizations and allied organizations, that this could lead to some substantial progress in the fight to end HIV in Black communities. And so again, this was some of the things that people were pointing to as beginnings, as a beginning, with a lot of work to be done, but we need policy changes that prioritize community investment and community control of resources. If we're going to have a future without future without HIV, where Black lives do matter and that Black communities thrive. So you can learn more about United We Rise at everyblackbody.org. And I hope I made it within my 5 minutes.
That was wonderful, Gary. Thank you so very much for breaking down what is United We Rise for everyone here. If you are very interested in that, go to everyblackbody.org. You're going to hear more in ways in which we are thinking about integrating some of these wonderful work that we're seeing from all the different initiatives and collaboratives of Black people trying to end the HIV epidemic, and talk about how we bring them together to truly talk about ending the HIV epidemic. Give me a second as I try to share my screen. And I believe all of y'all are seeing it. I'm going to start off by talking about the Black AIDS Institute policy priorities. If you can see behind me, there's this wonderful thing that we had come out last year called the We the People Report. A little too far away from me to grab. But the We the People Report was created in response to the Trump administration talking about ending the HIV epidemic and seeing a plan that did not reflect what our people truly needed or wanted in order to do that. We knew that there was other pieces outside of the biomedical response that were needed, and the policies that came out of that were created by the people. We call it We the People, which was the name came from Alicia McKinley Beach, for y'all to know in the South, and seeing one of her trainings, she really thought we needed a policy initiative that came from the people. And this helped, and we used, well, first it helped us think about what our policy priorities are going to be moving forward. And we used the We the People as a launching pad to understand how in which we tackle the social determinants of health, racism, the other inequities that we have historically seen that would not be tackled by the Ending the HIV Epidemic Plan. There was 4 key pillars to the We the People report, and we fit our policy priorities fit within each one of those pillars. The first one, which is dismantling anti-Black practices, systems, and institutions that endanger the health and well-being of Black people and undermine an effective, equitable response to HIV in Black America. That first pillar, it goes a lot with what Gary said. You got to get rid of the institutions and systems that have been continuing to be racist towards us, and we also have to get rid of those laws that have been racist, sexist, and historically. With that, the first one is ending HIV criminalization. We heard about it. I heard about it within the Southern session. We talked about it yesterday. This is an important piece for us to continue to work on. And we are committed to passing Representative Barbara Lee's Repeal Act. But along with that, we also have different folks within states that are connected to our BTANs, both in Georgia, Florida, Ohio, Kansas City, Missouri, that are working to end HIV criminalization in their states. And we also can connect that in dismantling anti-Black practices with making sure that people have access to Black voter rights. We know that there are a number of bills right now being passed on the state and local level to take away the rights that people that look like all of us to have access to what we want to do, and which is continue to make sure that we have political power in our communities. And with that, we understand that we want to pass the John Lewis Voting Rights Act that was introduced in the Congress last year, and also the Voting Act that was introduced this year, backed by many members of Congress, to talk about making sure and protecting those rights and pushing back against some of those state laws that we are seeing to try to take away those rights. And then we at the Black AIDS Institute are also committed to criminal justice reform and ending mass incarceration as a system, and systems that have been set up against us, that have been anti-Black in its history. We have to do something to address those systems, and we have to end mass incarceration and see a fundamental change in which our criminal justice reform. And we use within the We the People report an invest divest model, which we also connect with them in United We Rise, and you'll see with other pieces that I'll bring up, is that we need to invest in the institutions that are helping our community and divest from institutions and take away the space from things that are continuing to harm us, which includes the mass incarceration system, which has plagued our community for so long. And as I talk about investing into those next systems, we have to talk about pillar 2, which is providing resources and services that address the fullness, richness, potential, and expertise of Black people and mitigate social and structural factors that worsen health outcomes in Black communities. And this pillar is around dealing with the social determinants of health. And we understand, and I also got a chance to sit in a little bit on the housing and HIV session that was before this. We have to see a massively increase in affordable housing. We, along with AIDS United and many others, have signed on to this $600 million increase in HOPLA funding, led by, again, Representative Barbara Lee. And we really need to see a HUD brought more into ending the HIV epidemics. We have talked to leaders of the CDC. They also feel this way and understand that the future of the National HIV/AIDS strategy and the ending HIV epidemic have to bring these things in together. We also must address stigma, which in line with the We the People report, invest in marketing and community-led programming centers. The people that are most impacted by HIV would mean people living with HIV, Black, queer, gender, non-binary, and transgender people. And then guaranteeing comprehensive sexual education to all young people. Gary said it as well. That is an important one that we all understand that has to be done. For us to decrease the stigma of also HIV, we have to be able to be more comfortable and address sex. With that, we also have to increase the access to PrEP. And I would also, after hearing the Southern session, also talking about increased access to PEP. We want these things to be as easy to access as birth control or Plan B. And we have to make sure that we increase the access to it and also push back when we seek an increased amount of money that is necessary for people to even have access to these life-saving medications. And then eliminating poverty and reparations. We at the Black AIDS Institute do believe in reparations for our people, and we commend the Congress to actually opening up an exploratory committee about this, but going even further. And also we know that poverty is one of the leading causes, and we talked about, can we do this? But Rania, our CEO, was very adamant. If we're not doing something to eliminate poverty, we're not going to truly end HIV, and that has to be within our policy priorities and addressing the overall mental health of our communities. And this actually ties to our pillar 3, which is ensuring universal access to robust utilization of high quality, comprehensive, affordable, and culturally and gender affirming healthcare. Ensure that all Black people are living healthy Black lives. And with that, in order to do so, we're starting a Black Healthcare Access campaign. And if you're interested in expanding healthcare access in your state, you need to let us know, because we see folks that are working on this right now in Georgia, Alabama. We want folks to work this more in Florida, North Carolina, and to protect the rights of folks in states like that have expanded Medicaid, such as Arkansas and Louisiana, and protecting against work requirements and block grants. So we want to create a healthcare access campaign that is about making sure that all Black people have access to healthcare and ensures universal access. And we are also planning to back the Medicare for All bill that was just introduced into Congress 2 weeks ago. And with that, we understand that we have to ensure universal access and affordable comprehensive care, but we also must have high quality, comprehensive, culturally and gender affirming healthcare. And that gender affirming healthcare also means ensuring unfettered access to comprehensive sexual and reproductive health, fighting for abortion access and gender affirming care, and then mandating culturally humility training for organizations receiving funding in HIV. We continue to see organizations shell out racist care, shell out care that is not wholeheartedly caring about the human being. And we want to make sure that all those different entities that will be getting money, talking about ending HIV, do a better job of making sure that happens and guaranteeing mental health services for all. We do believe that everyone should have access to mental health services, especially coming out of COVID-19 and being locked away in their homes for a year. This is an important piece for us to do. And we're seeing some of this in the American Rescue Act, Plan Act. And we want to see greater showings of that in the future so we can also, more properly address these issues in the future. And then last is something that the Black AIDS Institute has always done is build the capacity and motivation of Black communities to be the change agents for ending HIV. That means allocating sufficient resources to enable Black communities to lead these efforts. It means ensuring that EHOs are responsible to the needs and circumstances of Black people. And for that first one around allocating initial financial resources, that means as our CEO and many others are pushing for is to make sure that the Minority AIDS Initiative is actually there for Black and brown communities to have the actual funding and led organizations to actually have the funding to address HIV. And, we really do this. This is a for us, by us method. We want to make sure our people are getting those resources. And if other folks that don't look like us are getting those money, we damn sure want to make sure that folks that look like us are getting the funds necessary and making sure that the funding for those Black organizations is there in the future EHE efforts. While also ensuring Black people in the positions and leading in ending the HIV epidemic. This means, as we saw with the last EHE efforts, expanding the healthcare workforce. We're seeing that even with some of our COVID-19 response, making sure that Black folks are in the position to be able to have this happen. And we do commend the current administration for Dr. Nunez, who is leading the health equity task force dealing with COVID-19. And we want to see more things like that in the future. And for us, as I said, almost everything, especially our top layer priorities, you will see if we are working on it nationally, we are also working on it locally within our Black Treatment Advocates Network. We have some of our BTAM members on this call here today. Thank y'all so very much for being here. Y'all are truly leading the different policy initiatives, and we want to hear from y'all what we're doing, whether it be housing in Atlanta and Charlotte, dealing with HIV criminalization in Georgia, Florida, Ohio, and Kansas City, or dealing with trying to increase funding for Black organizations that we've been seeing in Illinois. All of these things are also being worked on the local level along with the national level here at the Black AIDS Institute. And we're also lucky to be a part of a number of other formations that also connect us to this larger movement. First was started by Gary talking about United We Rise. And then we're also part of HIV Racial Justice Now, which had a declaration of liberation for building a racially just and strategic domestic HIV movement. Literally, our vision and mission is to have a racially just HIV movement in this country. And we vision a movement premised in solidarity, collaboration, and in coalition. And so seeing things such as United We Rise, seeing other initiatives come together to build to build together and also have an understanding intersectionality is a true important piece for us to be able to get the policies that we want to see. And so when we developed this, this was a very early on within the Trump administration, but also understanding that this is something that we wanted to continue to do and use moving forward. We understood that how do we get there is we actually have to, connect to our strengths. And one of our strengths is culture, is loving on the different aspects of the differently diverse communities that make up people of color, but also understanding and addressing anti-Blackness and how that shows up, specifically anti-Black racism that shows up between Black and Brown communities, Black and Asian communities, and other, how in which we address anti-Blackness as a whole, while also understanding that we also live in a context where we're in the United States. HIV disproportionately impacts Black people worldwide, but it also definitely looks different outside of the United States. And understanding the complexities of ways in which it looks around the world, we cannot just deal with HIV in the context of the United States. We also have to understand how in which it takes and impacts the world, understanding systematic inequities, and working to really dismantle, again, these racist institutions, as you've heard in both the United We Rise policy pieces, Black AIDS Institute. This document truly helped and put a framework out there that helped us build on it to talk about the policy priorities that are moving forward. And to understand what our vision requires dismantling institutions. And that is something that you have heard on multiple levels of talking about. There's institutions that have been historically racist. There have been institutions that have historically not been there for our communities. And we need to get rid of those or fundamentally transform those institutions to look like the community that they're actually trying to support, and also really take that meaningful involvement of people living with HIV and AIDS, the MIPA principle, and using that in all the efforts of the work that we're doing within HIV. And so our demands were integrate racial justice into our organizations and political strategies, which you're even seeing right now with the Asian United PPC going through the Racial Justice Index. Center those communities most impacted by the epidemic in leadership and decision-making. Root out efforts to advance a racial justice lens in the HIV movement and accountability to the communities that we lead. And that takes for the people that sit on the steering committee, which includes myself, but also for us to challenge those other leaders within the HIV movement to do better around race and ensure equity around allocation of resources, human, material, and financial. We know different organizations have different levels of capacity, different access to resources. How do we make sure that that is more equitable moving forward? And work to transform and, when necessary, dismantle institutions that are upholding white supremacy and compromise the well-being of our communities of color. And out of this, a few of us that were connected to HIV Racial Justice Now had seen that there was a need for also a political agenda, which led to Black South Rising. Black South Rising, which was originally formed in 2018, talked about Black Power on Black HIV Awareness Day, so February of 2018. We must speak for ourselves. We have to talk about Black leadership. And we understood that we have a history of things such as Jim Crow, racial violence, and other things that have impacted our communities. But we have to celebrate our commonality and honor diversity among our people, and actually fund the communities that are most impacted. As a person who started working HIV outside of the South, but I'm from the South and moved back to the South, it was wild to me how many non-Black people, specifically white folks, were speaking for HIV in the South, knowing that it disproportionately impacted Black folks. And making sure that those entities understand that they have accountability to the Black folks in the South, but also making sure that Black people should always be lifted up and have the ability to speak for ourselves when it comes down to HIV and how in which we talk about this Black power in the South. So we brought together last year in 2019 to 2020 was this project to come about, like, okay, what are we going to do with this? What are we going to talk about after bringing out this piece around in saying like, oh, y'all need to go do this. What was the next piece? Well, it was a political agenda to talk about how in which we ended the HIV epidemic from a uniquely Black perspective. And so Black South Rising is a collective of advocates and communities and organizations and leaders and Black people living with HIV. Black South Rising aims to work within the South to raise Black HIV movement leaders' visibility as Black HIV advocates doing movement work in the United States and in the South. We recognize the urgency and reframing the narrative addressing the epidemic. And so with that, we created a number of change initiatives, which included we assist on Black leadership and representation, assist on human rights and social justice, assist on the divestment and dismantling of destructive systems and institutions. We insist on funders changing how resource community projects, programs, and interventions, and we insist on implementation of workable solutions to address root causes. And we insist on accountability within our community, but also for those that are doing work for our community, and a right. And we talked about addressing those root causes. We have to address a livable wage, universal basic income, a right to affordable and equally safe housing, a right to affordable and quality healthcare, the control of our bodies and non-consensual research for medical experiments, a right to not be criminalized for behavior based on health condition or economic survival, a right to be free from unjust criminal justice systems, a right for comprehensive sex education, right to culturally expression and creativity. And we have three initial demands. One, a multi-year investment in funding and non-monetary resources from foundations to corporations must be made in support of Black leaders, organizations that must address the aforementioned social, societal ills and wrongdoings that have historically disproportionately impacted Black folks. Then we also must convert Black Southern elected officials, representation, and key staff members from the Congressional Black Caucus and Congressional HIV and AIDS caucuses and leaders from those Black coalitions in efforts to create a staff commission organized in interdisciplinary research and to develop innovative systems and programs that are culturally specific to the Black experience in America. And then we also want to confer with funders to support within that. And then lastly is the system and organizations exhibit racism and bias, intend or intend, must change or be defunded. If you continue to do racist stuff, you got to go. And we have risen. We know what we must do to secure our rights as human rights beings and citizens of this country, and we will resist every attempt from those who seek to deny us. And I can speak directly to that as a person who got a chance to come back to the great state of Georgia and seeing what Black political power can do, and can see that we have much more, much further to go when I think about some of the wrongs that we're still dealing with, be it housing, criminalization, or access to healthcare. We still have an opportunity to, fight back against these many things. And there's many different ways in which we can use this different information. We've done it with protests, meeting with legislators, having virtual town halls, bringing folks together. There's meeting with different legislators. And I'm excited to see what will be coming out of all this work. Thank y'all again so very much for listening to me talk for so long. I didn't see anything that was in the chat while I was talking. But now I want to open it up, if it's cool with Gary as well. And I don't know if any of our other facilitators had a chance to hop on. But to hear from folks that are on this call, and we will open it up. You can unmute yourselves. We want to hear from you. If someone start talking, though, don't just start talking over them. Put yourself in the stack. We'll try to keep, Gary and I'll try to keep number of who needs to go and talk next. But we do want to hear from folks, just hearing all these different policy priorities from United We Rise, Black AIDS Institute, Black South Rising, and HIV Racial Justice Now. Some of them that I've definitely thought that you've heard before, some of them that you may have never seen before or heard of. I would love to hear if you have questions on them, but also if how in which you're seeing these policy priorities show up in your local community. And if they're not showing up, what would you like to start to see within your community to be able to see some of these policy priorities show up? Okay, I'm checking the chat. How would someone get involved in some of these initiatives, such as Black South Rising, BTAN, and the other mentioned? So we have BTANs that are across the country. The Black Treatment Advocates Network is working to end the HIV epidemic in local communities. We have different chapters. If you are interested in joining the Black Treatment Advocates Network, I'll put my email in here. It is maxb@blackaids.org. Visit our website. We'll also get you connected. For Black South Rising, you can actually go to Black South Rising. Yeah, it's blacksouthrising.org to join the mailing list. And we're still like for Black South Rising, it is truly, we put out the agenda and now to see how in which we can start to look at that agenda and build our network of folks to talk about building this more political agenda. And the current steering committee, the interim steering committee, as one of those individuals, is working on building out Black South Rising and also seeing some key places that we can influence different processes to get some of those demands that we need along both on the federal but also on the local level. Oh, there's a Q&A. There's a Q&A? Oh. I see David Alexander says, South Carolina, I do want to let you know that we will be building BTAN chapters in South Carolina, specifically Greenville, Columbia, and Charleston. Thank you. I do want y'all to know that this is one of those sessions where y'all can unmute yourselves and ask your questions, especially you, Justin. But we would love to hear y'all voices as well. Unless y'all are muted, I don't think y'all are. Deidre, about Virginia, we're moving it back. We're building Richmond up again. David Wally Long will be reaching out to you. Justin, I haven't read your full question yet.
Oh, hey, thanks for a great presentation, Max. It really, I just have more of and I know that you're, deeply strategic, so I think you're one of the best people to ask this question. Is, what do you think we need to do kind of on more of our, local area? I mean, I'm thinking about Georgia. We have so many great organizers here, and obviously we've seen the power of Black political organizing here in Georgia specifically. How do you think we need to do a better job of engaging, our friends and colleagues that are doing that kind of broader work to get them to lift up sort of HIV as something that they also carry the mantle for? Because I feel like it seems as though, there's sort of the HIV advocacy space over here, and then there's like Black liberation work over here. And I know that we have a lot of the same principles and communities that we're accountable to, but it doesn't seem like we're necessarily moving and building in a way that is as kind of connected as it could be. And I'm just wanting to get your thoughts about that, or, how we might sort of improve that moving forward.
Yeah, it's been something that I've been thinking a lot about, Justin. Thank you so very much for that question. One of the things that we've strategically done even at the Black AIDS Institute was also being in more of those spaces, Black liberatory space, Black organizing spaces, and positioning ourselves in there, because I will say this: Black people have some of the worst health outcomes around when it comes down to different diseases. Even we found that around COVID-19, and in some ways, I think some ways it has been forgotten. And then also, some people forget about the slow death that comes with different comorbidities versus someone being shot and killed in the street and seeing that, literally on TV. I think one of the big things that I've been working on with the Movement for Black Lives and making sure that they did talk around HIV criminalization. They did talk about universal access to healthcare. Shout out to Kenyon Farrow, who was actually one of the first people to bring that up and make sure that folks were talking about HIV and healthcare on a Black liberatory space, is being in the room with them and making sure that our voices are heard throughout in those spaces. I think it is an important thing to continue to do. And there's also a stigma around HIV that I think we have to address, even in liberatory Black spaces. That is not always. We always don't think that we have to have that conversation there, but I think we have to have that conversation almost everywhere. And it does, I know, get tiring at times, but it's an important piece to that, and understanding where we connect. And someone said this to me. I think Greg Millett also said this is. Knowing where we can add value. I think we add value in specific ways because of the way in which we created some certain things like Ryan White, and how in which a Ryan White Planning Council shows that there's a way, and they're not perfect, but a community control version of the way in which healthcare is administered within community. We don't have that everywhere in all other forms of healthcare. That is something that we add. Our understanding of how in which people have access to healthcare is very important to add to our overall fight for better health justice for all Black people. Our fight around HIV criminalization, as we fight to overall decriminalize folks, is also understanding we have something to offer to those folks that are doing that work, and making sure that they need to also then start to show up for us. And something that Justin, we had talked about at United We Rise was intersectional solidarity. Which was showing up for some of those things. I worked really hard to also show up. I know that it's important for us to fight for abortion rights as much as it is for us to fight for access to HIV medications, including PrEP. So with that, I'm gonna show out for them. And then also, hopefully, as we continue to engage, and what I have actually seen is they will also show up for us. And that was a long answer to that question, but thank you for that question.
Thanks for the answer.
Other comments, questions? I'm sure there's lots of them out there.
I'm seeing. It's hard to keep up with all the comments, y'all. So if you would like to just say what you would like to, that would be well. Marcus, I know you can't unmute yourself. If you want to put your question in the chat, if you put a question in the chat earlier, I'm trying to go back to it.
Marcus.
Ooh, okay, Arizona. We have heard interest for BPN chapters in Phoenix. I will say we are more concentrated on focusing some work in the South, but we are looking at Phoenix, Portland, and then continue expanding our work in Indiana. Some of the places outside the South, don't count me. That's where we are right now. And I said yes to Richmond. And definitely, if you're in South Carolina, definitely reach out to me ASAP. We definitely get maxb at blackaids.org. We're definitely looking to expand there. Oh, there's Virginia's deep in here. Okay, good to know. I would honestly like to hear, and if y'all don't start saying anything, I'm gonna start to pick on some of the B10 folks in here. I just want to let y'all know that. To talk about how in which you see some of these policy priorities and how that connects with some of the work that you're seeing locally.
Max, while your B10 folks are thinking about how to respond to your question, I just wanted to really chime in for a second, because I think, like a lot of folks in the chat, I think this is a really good conversation, and it's definitely a lot to digest. And a lot of times we're trying to figure out, like, where do we start? Because there's so much to be done, especially when we're talking about taking on this approach of racial and social justice, and how does that fit into the work, especially around EHE. And so what Houston is planning to do in the next month or two is have conversations around race and HIV, and this will be our health department will be one of the leads in planning this. So I think that's a great step, to have like real dialogue about like what does it even mean when we say racial justice? What does that even look like in our activities, in our actions? So we would definitely love support. I know we've been thinking about reaching out to some of the coalitions you mentioned, and I personally will be following up with some of y'all. But if you would like to help us in having these conversations, so that we can develop some recommendations or something that can be tangible in our EHE planning activities, we would love that support.
Yes, Crystal, yes, for me, you know, I know Kevin's already reached out to you about the work that y'all are doing in Texas. I also, I'm gonna call him out because I can. Coleman, who has also worked around the Illinois plan to ending HIV, which actually got some input originally from Benita from Houston. So I see this connection and how in which this all turns around. That has been doing some of that EHU work also for Illinois. And their lead, and talking about some of the really good like community sessions that they had to be able to create some of those feedback. But also, Crystal, you can always reach out. BAI is more than willing to also and have some of those conversations and help even lead with some of those conversations. So definitely reach out to us. You know, I know Gary did get. I think Gary might have said this. We were planning to have the in-person United We Rise convening in Houston before COVID. So that sucks, because we definitely would have been able to kick off some more of those conversations. But one thing that I've definitely seen on the policy side and some of the updates that we've been getting is, because of COVID-19, we actually have more time to maybe get some of the things that we want around HIV, while also understanding, I think the bad side of it is there will be cuts somewhere because of how much money we have spent in order to respond to the COVID-19 epidemic. And we want to make sure that is not HIV, but also actually see like, how are we seeing some of those greater conversations around dealing with disparities, racial inequities. I do say some questions in here I want to address. I know one was around Mississippi from Marcus McPherson. I want you to know that Rimsky, who is leading our Mississippi chapter now, and shout out to her coming into her, one of the new leaders for the Mississippi chapter, is actually in here. Marcus McPherson. If you see Rimsky on here, I don't know if she can say hello or say what up to folks, but she's actually leading our work in BTAN, Mississippi. And as a person who also came out of a BTAN chapter, I came out of BTAN Chicago before joining at the Black AIDS Institute, is I understand that certain times there's folks that need to take a step back. And for folks that have taken a step back, this is a great time to come back into the BTAN if there is one in your local area, if you're looking to build one out. And really talk about some of the advocacy pushes that you're seeing, because folks, there's 12 different BTANs that are moving advocacy plans right now, and we'd love more support to be able to do and to address some of those disparities. And I saw Rimsky, I saw you show your face. If you want to say hello.
Yes. Hello, everyone. I am Rimsky Evans, Mississippi. I'm new to this, and so I am now the lead person of BTAN Mississippi, and I'm looking forward to collaborating with a lot of you in the different organizations so that we can get Mississippi on board and moving.
And there's definitely some. Thank you so very much for speaking. There's definitely some definitely moving around the ending HIV work, and our BTAN has been highly involved in the EHE work going on in the state of Mississippi. So thank you for that. I
Hello,
see
everyone.
Mark.
Hi. Oh, sorry. Hi,
Go
my
ahead.
name, yes, hi, sorry. I just wanted to take a moment and introduce myself as well. My name is Mallory Jenna Robinson. My pronouns are she, her, hers. I work in Los Angeles at the AIDS Projects Los Angeles in their transgender health department called Trans Connections. And so as a woman who not only is trans, Black, and HIV positive, I just want to say what you all are doing coming together as a collective right now to really talk about the disparities in these marginalized communities that impact all of us. I just want to say thank you, and thank you for also including trans individuals in this narrative, because oftentimes we are underlooked, and even the immigrants, because I do have Haitian ancestry, and I do know a lot of my Haitian community, especially the immigrant community, does face a lot of disparities with HIV. So I wanted to just come and just take a moment to just say hi, introduce myself, and just look forward to collaborating with each and every one of you in any way for the greater goal of ending HIV. Thank you for your time.
Thank you so very much, Mallory. And we'll definitely look to connect more. We have restarted some working within. We are always doing work in Los Angeles because we're headquartered there, but also working in some of our policy and advocacy side, and are working within California. And I get to work with your policy team at APLA quite a bit when we have California meetings. So thank you. Let's see. I've heard, I want to address one specific thing that I saw Marsha Martin. Did you want to say your question more, or speak to the question that you had brought up more out loud?
Hi, Max. No, it's okay. It was just really a question about, everybody talking about race, disparities, all kinds of healthcare access issues. And, we've had the Minority AIDS Initiative for a million years, and we've had a lot of good work going on all over the place, but we get stuck on a state level and a local level. And so I was just really wanting to ask you to sort of say a little bit about advocacy, because, we could do a lot of interventions at our state AIDS office level to try to figure out how we can better serve communities on the local level, right? And I just was curious to, see what you might be thinking in that area, because you're such a wise man and you've been, out there on the ground doing the good work. So give us a little bit of your thinking, your experience, and how we should be thinking about our state players, because, there's a lot we need to do on the local state level.
Yes, thank you so very much for that question. I really want, Marsha was like one of the first people to say hello to me and put some wisdom into me at my first AIDSWatch ever. So I just wanted to shout that out. But I think one of the things that we've been looking very much on the state, I would say on the state side, is looking on, especially in the southern states that are EHE state specific or have multiple counties like Florida, Georgia, Texas, is to truly also be truly integrated in some of the ending the HIV epidemic work. And on the state side of the AIDS project is, I think we're getting a lot of pushback, especially I would say, again, concentrating a lot of work in different southern states around the healthcare access argument and even the increase to the housing argument. But I've seen one of the key points is getting more of our advocates to be a part of those conversations. Coming from Illinois, and I'll actually say this, and this is a challenge to all the large AIDS service organizations. One of the biggest problems I've seen from the AIDS service organizations in the South is they truly do not want to take advocacy to the people that are most impacted to the level that is necessary to move their ability to end the HIV epidemic. And if we continue to see that, they have the AIDS service organizations get the most money when it comes down to from HIV, but there is not enough done around making sure that there is real folks being able to advocate and go there. And there should be, I know that there's around a 10% budget, or I think the increase for 501c3s to be able to do lobbying work. But being able to teach your I think it is a way around that is actually teaching your advocates so they can then be the advocates and actually lobby for themselves. And I think that is an important player that many of the AIDS service organizations who get millions of dollars in HIV funding could actually make sure that the people that are most impacted are getting the opportunity to have those conversations with their legislators. I've seen how impactful that is. I've seen legislation move because of having those conversations with legislatures, especially when it comes down to around things such as HIV criminalization, or even things such as having young or bathroom bans, or things such as that we have seen. I've seen legislators' minds shift because those stories were told. And especially on a state level and even on a local level, because they didn't think people within their community cared about those issues. And I do want to shout out, such as organizations as the AIDS Foundation of Chicago that have built a network of actual folks from across the state that can actually speak to these different issues, be it Black or just people living with HIV that can speak to that lived experience. It changes legislators' minds, and we have to actually challenge our organizations that are getting all of this money to actually empower the community that is actually that needs these resources the most. So I would ask them to do that, to do more of that level of advocacy, and actually let the advocates lead it, and they should support them through it.
Great, thanks.
Thank you, Marcus, for your feedback and thinking about how in which we see those things on a state level. We also got 5 minutes if someone else has something that they want to say. I'm also from.
One thing I want to add, Max.
Thank you, Devin.
Hey, so
Devin, you want to introduce yourself?
Sure. My name is Devin Hersey, he, him, his, and I represent Kansas City, Missouri, but I'm in Columbia, Missouri right now. So the Black AIDS Institute also supports BULI, which is the Black United Leadership Initiative, which is a network of Black people who are doing advocacy around HIV criminalization. It's just bringing everybody together nationally so that we can really build on each other's capacity and create our network so that we can, feel safe and included, because oftentimes we end up feeling pushed out of the work, even though we're among the most impacted by HIV criminalization. So I just want to let everybody know to look out for us at the HIV is Not a Crime Training Academy that's coming up this year.
Thank you for that. And I see, thank you so very much for that, Devin. I also see, I know Deidre, I shout out y'all in Virginia, Cedric is on, Davina, I see y'all, all members of BULI working to end HIV criminalization. As I said, it's one of our top priorities at the Black AIDS Institute, working both on the state level, but that local level, and it's not even possible without Devin and many others leading that initiatives on the state and local side. I see you, Dante. I see a couple, Dante in Charlotte, Coleman in Chicago. Thank all y'all so very much. These are also folks, I know we have different sessions in between sessions that you can do some networking. Wonderful, all the folks' names who I've called out are definitely wonderful folks to engage with for this. If you want to talk about how you can move forward in your local area, if you're looking to help in HIV criminalization, housing, healthcare, and a number of other issues that the folks are, or just locally how in which to tackle your local HIV epidemic. I believe that all the things in the work that y'all are doing locally ties to the national and the ask that we will have of legislators tomorrow. Thank y'all so very much for taking this time and space to be here with us. and hear the different things that our folks are working on. We have 2 minutes. If anyone has a burning thing that they needed to say, wanted to get out for this session and let other Black advocates that are attending AIDSWatch know, this is that time.
Good. Hello?
Yeah.
Oh, I wanted to mention one thing that you were talking about, Max. And the thing about it is, in South Carolina, I am so sick of going to planning council meetings, conferences, where they talk about the disparity of African Americans compared to every other race, but yet when they come up with a plan, they're not putting us in the front. So why are you going to talk about the disparities, but yet not implement us in the front of the conversation when you're talking about ending the epidemic? I mean, like you said, we had an internet epidemic plan here, and we looked at the tables, and like we said before, you had a lot of providers, but you didn't have anybody in the community in the plan. So how are you going to have a plan when you don't have anybody that's being impacted and part of the process of bringing up, the strategy of the plan?
Where are you located?
Hello?
In South Carolina. Oh. So I see Carmen Terrell wanted to speak. Gerald, where are you in South Carolina?
Columbia, South Carolina.
Columbia, we will be talking to you. Send an email. We'll be talking about more about it, and to get some of that support nationally to be able to push back some of those local ways. Different advocates on this call have done it in the past to call on us to be able to do that, and that's what we're here. I thought Carmen wanted to say something. You'll be our last one.
Yes.
Go ahead.
Yeah, because I wanted to piggyback off what he was saying. Okay, can you hear me?
Mm-hmm. Yes, ma'am.
Hello? Okay, yeah, no, I was just gonna say that, yeah, I'm piggybacking off what he's saying too, because I mean, you got those that are saying all of that, but yet there are people that are really impacted and everything. I don't know if it's because they're scared or whatever the case it is, but yeah, I agree with what he's saying, because I mean, I'm like I was saying in the chat, I'm out here in Arizona, and it's like, I'm trying to reach out to people, and I just don't get any avail. I mean, I can hardly get anybody in the women's group that I even speak at, to get together with me or in some shape, form, or fashion to come up with something like this either. I mean, it's not enough fight out here in Arizona, and I'm not that type of person that's just gonna sit back and just let stuff happen. I've got to do what I got to do. I gotta say something, because it's this particular situation here, as well as other things like education and stuff, I speak out for. And I just wanted to say that I agree everything of what that gentleman that last spoke said, but I wanted to say, something else too on that. So that's my input.
One of the biggest things that I try to continue to do with B10 is make sure that I know sometimes that for Black advocates that it does feel lonely, or being that only person at the table, or not having additional voices. One of the beliefs of B10 is many voices are stronger, and we also teach each other so we can be able to support one another to push the policies that we want to see. And we have a little fun while we do it. So we're trying to do that, and to keep our folks keep our energies up. We are at time. Please use the social settings to connect with each other. If you have questions, please reach out to myself or Gary. Thank y'all so very much for being in this space. Continue to connect with one another, and y'all see me in different meetings, and see y'all talking to legislators virtually tomorrow.